Therapy, a boutique in-home private pediatric speech, language, and dyslexia therapy practice serving families living in the mainline area from Ardmore to Malvern, PA. They're dedicated to helping children's speech and communication skills develop and grow as they are essential to their academic and social success. Owls Therapy offers comprehensive evaluations and devises individual therapy plans that best match your child's personal needs. They also offer all therapy in-home, provide parent and teacher training, offer classroom observations, and help with navigating school-based services. Learn more at owlstherapy.com. Hello, and welcome back to Parenting Stuff That I Wish I Knew Sooner and Want You to Know Now. I'm your host, Erica Desper, founder of the Center for Confident Parenting, and a mom who seems to learn everything I needed to know the hard way. My guest today is Dr. Anna Bolshin, a pediatric physical therapist with over 15 years of experience and the owner of Loving Touch PT, where she provides mobile, in-home pediatric physical therapy, specializing in early childhood. Dr. Anna, thank you for joining me.
Thank you so much for having me. I'm loving this. We all wish we would have learned things sooner. Trust me, you're not the only one.
Right? That is the premise of the whole thing. I know I'm not alone in that. And like, why not spare someone the same the same learning process?
Absolutely.
That is the mission here. So I'm really excited to have you because I know you are a wealth of professional knowledge and you are a mom yourself. So yeah, tell us a bit about you, your family, and of course, what brought you to this type of work.
Sure. I'm a mom of two and a dog. Yeah, I have two boys, a 13-year-old and a 7-year-old. And despite the fact that I'm a pediatric physical therapist and you would think I would know better, you definitely have mom goggles when it comes to your own kids. I also felt that even as a pediatric therapist, for me, it was hard to find information, right? And you would think that it would be easy, but it's not. I also felt like as a healthcare provider, when speaking to physicians, even as a healthcare provider, you kind of get discounted a lot of times as a mom. Probably even more so as a medical provider, because sometimes, it's like, well, you're looking for things that are not there, just because you know about them. So my mission, in addition to treating kiddos, obviously, as a physical therapist, is also educating parents, empowering parents, letting them know what resources they have, right? Not every kiddo needs to be in PT by any means. But what are the things that you could possibly look for that'll give you a clue of what they need? How can you play with your baby, right? Like no one teaches parents. We are very focused on obviously eating, that's important, and sleeping and pooping and all of that is super important. And I understand why that's a priority, but how to hold and position and play with your baby affects all of that. So I just want to empower parents and not have to have them search through, the Instagrams and because a lot of that information is great, but it could be overwhelming. So
absolutely, and conflicting, and just all the things. Yeah, that's interesting that you had a harder time as a medical professional. I hadn't had that perspective yet, but I could see easily how that would happen. And yes, thank you for keeping it real that we're not alone. We don't have anything all figured out. So one thing that's a little unique about your practice is that it's mobile. So you come into the home. In your experience, your opinion, what is the benefit for the child and the family of evaluating and treating in the home?
Yeah, I mean, there are a number of factors. First and foremost, the kiddo is comfortable. They're in their safe space. They're not in an office, in a medical space, in a new environment. And they could then move the way they normally would. No matter how pretty I can make my clinic space, and no matter how many toys I may have, they're going to be thrown off, right? It's not their space. So one is comfort. Two, I feel that with little ones, by the time you get them in a car seat dressed to an office, there's already an element of fatigue, right? If they fall asleep in the car seat, you've now woken them up. So they're just off their routine, and it makes participation for them more difficult. And then three, too, it's important for me to see the environment because I can give you suggestions in a perfectly set up clinic all day long. But if you can't carry that over into your life, then it becomes so much more difficult to do, right? I don't want parents to feel like I'm giving them a home exercise program and something extra to do. There's obviously an element of that. I'm not going to lie and say that there isn't, but if I can help incorporate that into their environment and into their life, it makes things easier. And that's where progress really happens. I always say it doesn't necessarily happen within my sessions, it happens in between sessions if you're able to easily incorporate it into your routine.
Yeah, I love that model. Those are all really great points and logical, but it's, not super common yet. Maybe, maybe it will be in the future. So most of us, I think, know that the typical things that physical therapists treat. So I would like to kind of gloss over that and focus on your areas of specialty. So tell us the work that you do surrounding tethered oral tissues. And of course, let's not assume anyone knows what I'm talking about. So also
Mhm.
just tell us, what is that?
Sure. So there is a lot of currently media attention untethered oral tissues, commonly known as tongue ties. It could be the tongue, it could be the lip. It's tissues inside your mouth that didn't develop and don't have the mobility that they would have without being tethered or essentially attached more than they should be.
Like a really
Um,
tight rubber band that can't stretch.
Exactly,
Yeah.
exactly. So you can move your tongue as well, essentially. The tongue develops in utero really early on, so at around 8 to 11 weeks gestation.
Mhm.
And we have a fascial line that runs all through our body. Fascia is a connective tissue that runs between the skin and the muscle layer. So for those of us that eat meat, I always ask that question on intake now, do you eat meat? Because if you imagine yourself working on a chicken breast, that film that you sometimes have to take off the chicken breast, that's fascia, and that it's actually a very strong structure
Mhm.
despite the fact of how thin it is.
Mhm.
When the tongue develops and doesn't deattach the way it should, it kind of unzippers. And
Mhm.
when that doesn't happen, the rest of the fascia line grows with that tension or with that asymmetry.
Mm.
So, as a physical therapist, I don't just look inside the mouth, but I look at the entire body to see where else is this fascia restricted, where is there tightness, where is there an asymmetry. You'll often hear the term body work being used, so I guess I
Mhm.
would fall under that. The reason I'm not a huge fan of that general term is because body work can be different.
Mhm.
Body work can be a technique that I utilize called total motion release. Essentially, body work is us addressing the body to assess and to see what secondary effects of the tongue tie
Mm.
there may be. Body work can be passive and body work can be active. So when it's active, there's a strengthening component to it as well. But essentially, I think the bad rep that tongue ties and releases have right now is when you rush to do the procedure, but you don't address, right? The tongue is a very strong structure, but
Mhm.
it's still a small part of a large fascial line. So when you don't address the rest of the body and when you clip the tongue, sure, you're giving it range, but what about everything else that's below? Is it still going to pull
Mhm.
it down?
Yeah.
So that's where I come in. A lot of these babies may present with term preference. A lot of these babies may present with plagiocephaly, depending on how severe that torticollis is. They could have a flattening on the side of their head, but a lot may not. That doesn't mean that they don't have these asymmetries or restrictions. These are the babies where, you'll hear the term colic. You might have issues with GI and bowel movement. You might have issues with reflux. And I think the trend is, we're fast to Medicaid. We're fast to call it colic, and colic is normal and they'll grow out of it. But essentially, colic is a general term for when you don't know what's going on. And just because something happens frequently doesn't mean that it's normal and it can be addressed.
Yeah.
And that's where
You
I come in.
mentioned Yeah, you mentioned total motion release, but can you explain that a little bit more?
So it's a very systemic way. The reason I love it so much is because you're able to teach it to parents. So it's a treatment technique. The way physical therapy works is we all graduate as generalists, sort of like a PCP, and then we
Hmm.
decide, do we want to do pediatrics, orthopedics, whatever it may be. And then within pediatrics, each therapist then does continuing education and certification and methodologies that they resonate with. And total motion release is one of my techniques that I absolutely love for all kiddos, oral ties or not, because it's a systematic way of looking at the body to find these asymmetries, or you might hear the word tension in babies or pull, and then release them by how you're positioning them or holding them. So it's very easy for me to teach it to parents, and that's a huge component of my practice is, again, what can you do in between visits that's really going to facilitate that progress and give that carryover. It's really not about what I do. Me coming in to see you an hour a week is not going to change anything if you don't know how to address the problem on your own. So I really, really focus on kind of teaching parents to think like me. I like for them to be able to think like me, and then I feel really good discharging because they don't necessarily need me anymore.
Right. We're all trying to work ourselves out of a job by doing it well, right?
Pretty much. And that's what I say on intake. I say on intake, I really focus on educating you and empowering you to handle this on your own so you could get rid of me as soon as possible. Because when we have a baby, we don't foresee them needing physical therapy. And that changes your parenting kind of experience, right? There's nothing wrong with getting your child services when they're appropriate. But everyone wants to get rid of us, understandably so. And that's why I love TMR, because with TMR, I'm able to get to the cause of what's causing whatever that concern is in the child, address that cause, and then you don't need me anymore, right? Because that I say that kiddos don't need to be taught how to move unless there's something keeping them from moving. We all inherently want to move. So it's not about practicing, if you're having difficulty with tummy time, it's not about just practicing tummy time, or it's not just about practicing sitting or practicing crawling. We need to figure out what's keeping them from doing that, because if we can figure that out, then they're just going to take off on their own.
And that's important, I think, for parents to know that, yes, it can be overwhelming. It maybe isn't what you pictured. Yes, you might be given homework to do in
Yeah.
between, all those things you already said. And you may not be talking about weeks and months and, well, probably weeks, but not, months and
Yeah,
years of sessions.
absolutely.
And that once it's resolved or they're caught up or whatever, that's it.
That's
You
it.
do, you
Exactly.
do move on. Um,
Absolutely. And that's why it's important to find the cause, because it
mhm.
turns into months when you're just practicing the, kind of
Yeah.
standard PT, and why I'm so focused on continuing education and I'm constantly looking for new things to learn, because just practicing what's difficult without getting to the root cause is not going to change
Yeah.
your child's they might learn how to do what's difficult eventually depending on the activity, but it'll be with compensations and it's not going to be pleasurable, right? We want movement to be pleasurable. I hate, when I graduated 15 years ago, everyone used to say PT stands for pain and torture, and I hated that, right? Like, it shouldn't be pain and torture. It should be fun, especially for kids.
Right. Yeah.
um
That's
and when
interesting because
you
I associate it with relief, but I guess everyone's experience is different.
Yes, well, you've had good therapists. That's why you associated with relief. But yeah, getting to the root cause is super, super important to make things quick and easier to resolve.
I mean, I see that in what I do too. If we talk about sleep for a second, a big question parents of older kids always have, like, what about melatonin? What do you think of it? Is it going to work? Should I use
Yep,
it? I'm neither for or against it. I just want parents to make an informed decision. But the first thing I always say is my main concern is that we're just going to be masking whatever's causing the struggle. And
exactly.
so if you ever try to get off of it, like the struggle's still there. So
It's
it's kind of
still
like putting
there.
a Band-Aid on, a gaping wound, but we're not really going to get anywhere. So put all the other concerns aside, like that's my biggest concern. So I'm sure in lots of practices we can find that issue. So another thing you do that's probably unfamiliar to everyone is Cuevas medic. Am I saying that right? What
Cuevas
is
medic
that?
that's another technique that I absolutely love. So there are two, my practice, I like to say in a way is twofold. So there's that wellness approach education, and then there are kiddos that need physical therapy as an intervention. Kiddos with neurodevelopmental conditions or delay, where there are some kids that get too much therapy, and then there are some kids that don't get enough therapy. And then there are also some kids who, because of a diagnosis or for particular presentation, you're assuming they're going to need braces, you're assuming they're going to need walkers, you're assuming they're going to need wheelchairs. Again, based on a diagnosis, based on certain standardized tests. Cuevas Medic gives the child the opportunity to I say it maximizes their potential. So it's a technique that's utilized to kind of spark the brain and provoke postural reaction. So it's about the sensory input that I'm providing, where I'm holding them, I'm taking away bracing and equipment, and I'm trying to, via the input that I give them, elicit a postural reaction. So, brain, we're standing. We need you to turn on and help us stand, right? And giving all of that input to the brain and seeing what connections we can make to that elicit that postural control. Does
And
that
you
make
have
sense?
and if it doesn't for someone, I would suggest they go to your Instagram page because you have some awesome video clips. Families have let you share when you're working in the home with
Yeah.
a kiddo, like showing literally what you're
Yeah.
talking
Yeah.
about. It's so exciting to see them
Yeah,
stand
I
and take
love it.
steps.
It's one of my favorite things to do because parents are frustrated with the bracing and with the devices and with the standard, we're going to see your child once a week for the rest of their school life. But again, not giving them the opportunity to get to where they potentially can. When you overbrace and when you provide devices too soon, you're taking away that ability to develop skills that they still may have. And not to say that there isn't a space for bracing and devices. I'm not against them by any means, but I hate that we rush to that sometimes. And I hate how we think, well, this child has cerebral palsy or this child has Down syndrome. And that means that their potential is only here when it could be here. We just don't know. The creator of this theory says that our job as therapists, we don't know. So I'm not going to tell you that every child that has a diagnosis, I can help, right? But our job is to give the brain the input, as much input as we can, and see what connections the brain can make, right? So it's not up to us, it's up to the brain, but we need to give the brain that opportunity because in kiddos, the brain is still growing and developing and is so flexible that we need to give them a chance.
Yeah, and it reminds me of a term that I hear a lot that I'm a fan of is just to presume competence. Like we don't know what any one individual is capable of unless we assume that they can do the next thing and we create a situation to make it possible and then we see.
Yeah.
I know of kids that like everyone thought they couldn't communicate and they were given a communication device and like they have so much to say, right? So it's like, again, it depends, like, why is it happening? Let's figure out what they can do. And that sounds like a great way to do that. All right. So running down the line of your unique offerings, what is kinesiology taping and who is that for?
So kinesio tape is commonly known as sports tape. You'll see athletes, right? You'll watch all the big, I think probably the soccer and the basketball players, they wear the least amount of uniforms. So you'll see them taped. And kinesio tape, unlike a brace, right? A brace locks you in place, but a kinesio tape helps to turn on muscles. And, for example, with that total motion release, once I'm able to give them that symmetry when I'm not in the home, in addition to training the parent, how can I make sure that my hand is on that child in an area that I want to strengthen or to activate? So that's what kinesio tape does. Therapists kind of refer to it as our hands on the child in our absence.
Interesting. And so are you teaching parents how to remove it, reapply it till you come back, or is this something
Yes.
that remains till your next visit?
So it's usually we're teaching how to remove it and how to apply it. Pretty much everything that I do that's safe for the parent to do, I teach the parent to do. So some of the quavasmetic exercises, require a lot of handling and training on my behalf. That I'm still getting support from my mentor, right? So I'm not going to teach a parent something that is
Right.
dangerous, right? Because our reaction time as therapists is developed.
Quick.
But anything that's safe and the parent can do independently, I truly believe we can teach to the parent. And again, that's where carryover happens, and that's how they get rid of us sooner.
Right.
The
Exactly.
best for me, the easiest family to work with is where the parent has that ability and wants to learn and wants, sometimes it's too much for me, it's overwhelming, I just want you to come in and do this, and I get that as well, right? Because in addition to physical therapy, there could be a lot of other needs,
And other siblings.
siblings,
And yeah.
work, exactly. So not to say that there is something wrong, and even in those situations, I make it easier. And this is how you hold them. You're holding them anyway, right? So I really try to make it part of their routine. But when the parent
Something
is
you're already doing.
exactly, just do it a slightly different way. But in a situation where the parent can really pick up, and we all have different interests and skills, and some are just really good. At picking up certain skills, and that's when the child gets better the quickest, right? Because they're able to pick it up and incorporate it into the routine.
You also offer therapy for breathing and postural control.
Yeah.
What's
Yeah.
that about?
So it all goes together. If we can, the course used to be called, I think they renamed it, if you can breathe, you can function. Right? Breathing is a vital function that we have. If we can't breathe, we can't speak, we can't eat, we can't stand, we can't walk. So looking at how the child is breathing, which breathing patterns they're utilizing, trying to take them out of less efficient patterns and getting them into more efficient patterns is helpful in improving function. Part of that is bringing symmetry to the trunk and then strengthening the trunk. The trunk is like a girdle for our diaphragm, right? The diaphragm is the primary muscle of breathing. So if we have asymmetries in the trunk, and if we have weakness in the trunk, and the diaphragm does not have the support or that counter pressure in order to be able to function well, it's going to not function well. And the child is always going to prioritize breathing, right? They're going to fatigue. The diaphragm also contributes to stability. So if the diaphragm is weak, it's not going to care about stability. It's always going to prioritize breathing. So that goes hand in hand with any functional activity.
Got it. Got it. And how you also do some massage.
Mm-hmm.
How would I know how I benefit from massage.
Mm-hmm.
How would a child benefit from massage, particularly if they are in need of all these other things you're talking about?
Yeah, so I incorporate it into the treatment. So you're never going to get like a massage session per se from me as a therapist. Some physical therapists, will do just that. It's about touch becoming pleasant. It's about connection between the parent and the child. It's about relaxing that tense, tight body. Depends on the kiddo. If there is a diagnosis that the kiddo required, hospitalizations for, blood tests for, right? They're used to touch being unpleasant stimuli. So how do we make it pleasant, right? Massage also helps the lymph flow, helps to calm the nervous system. So that could be very beneficial tool, especially for kiddos that may be averse to touch.
Yeah. And you talked about parents, not being taught how to play with their babies. I think massage is it's just a great bonding
Huge.
experience. It's a great activity, even if your child has no issues, no
Exactly.
concerns. It's just like you're
Absolutely.
staying awake for a long time. I don't know how to fill the day.
Exactly.
Why don't we do some massage? Yeah, I think that's great. All right. So those are all your unique things. It just, like I said, you are a wealth of knowledge, and I love your take on everything. It just sounds very comprehensive. So I've talked about this before, but I will never stop talking about it. A lot of parents, when they express concerns, and this happened to me multiple times, we are told to, we are poo-pooed, you know. And you talked about this at the outset.
Yeah.
And the common phrase is, let's wait and see.
Yeah.
I'm sure you're not a fan of that phrase, but I'll let you answer. In your experience, how critical is it to intervene early for the types of issues that you are helping kids with?
Yeah. So I feel like rather than the wait and see, we should try the while you're waiting, do this and see what happens. Right. So again, I'm not saying that every child needs physical therapy, but I like it when doctors, something simple, torticollis, right? We have a head turn preference. Rather than just saying wait and see, I love it when doctors say try to reposition their heads and see what happens. Sometimes it's just because the child was crunched up in a certain way in utero, and sometimes just repositioning the head can help. Absolutely. If you're having difficulty and if you're trying to reposition the head, here's the resource, right? And here's what you're going to do. The issue, and again, I'm very careful. I don't want to fear monger and say like, you need to do this for your child and you need to do it now. And if you don't, it's the end of the world. But we need to know if this intervention is not working, where do you go? Both from a musculoskeletal perspective and from a neurological perspective. If there is any sort of pull or tension or asymmetry, as we start to move, right? I said everyone wants to move. So kiddos figure out how to move. It might not be in the ideal pattern, but they figure out how to move. And then they end up strengthening in those asymmetries, right? So it ends up being more difficult to get them out of that asymmetry because now they're strong in that compensatory pattern from a musculoskeletal perspective. From a neurological perspective, the brain within the first year does so much work. It's we call it neuroplastic, right? You could mold the brain. And the older we get, the more difficult. You could still mold the brain through adulthood. It just takes longer, right? Or if you've already developed certain motor plans, you have to undo those motor plans and teach new ones, right? And what I tell parents, if you have an inkling that something is wrong or something is different or something is not right, at least with me, you'll come in, you'll get an evaluation, and let's say your concern was not founded, which I rarely find to be the case. A parent never really wants to find something with their kid, right? So if something is there, chances are it's there. But even if it's not, you're going to walk away with knowledge of what to look out for, what to screen for, how to move your baby, how to progress them onto their next milestone, right? So it's like the cost benefit, right? If you don't intervene and if something is truly telling you that something is off, what's the cost of that, right? Versus if you do intervene and if nothing is wrong, but you just learn additional information, what is the cost of that? Does that make sense?
Absolutely. Absolutely. You're preaching to the choir.
Yeah.
So that leads me to a follow-up question. If a parent's gut is pinging or they're noticing a difference, from the baby's peers or whatever, and they bring it up and they're told to wait and see, like, what is our move at that point? What do you suggest?
So in many states, and Pennsylvania specifically, for my practice as a physical therapist, we have direct access, which means that you actually don't need a referral to seek services. I'm able to treat a kiddo for 30 days or 10 visits, whichever comes first. And I've yet to see a kiddo not in a hospital more than 10 visits in 30 days. So it's usually the 30 days I can see that kiddo without a referral. So you just seek out services based on your concern. And I tell parents, you spend 24 hours of your day with your parent. No, with your child. No one knows your child better than you do, myself included, right? So I'm not just talking about, physicians, I'm talking about myself as well. And I could tell you anything I want to tell you, but you know better. I can give you whatever suggestion I can give you, but you know better. And I tell parents that I feel that there is that like white coat syndrome in kids and in parents, right? And at the end of the day, I like to say we work for you. I, as a physical therapist, work for you. The doctor works for you. Yes, we have an area of expertise, but you're still the consumer. And just like with anything else, if you don't like what you've purchased, you could return it, you know? And you could ask those questions. I hate it when parents think that I'm the expert,
Mm,
right? Like I have a knowledge of what I have, but you're the expert on your kiddo. And they say you're the leader of your kiddo's team, not
mhm.
me. You know, they'll say, Hannah, you're, you know, a mom followed me on Instagram yesterday. And I said, you know, thanks so much for the follow. And she said, oh my gosh, Hannah, you're great. Not, I mean, I'm good at what I do, but I'm guiding you and you're incorporating it, right? So it's
Right.
not just about us, it's about you, and you
Right.
have the right to have a strong voice.
Yep. I love that so much. Okay, let's do a shift. take your
Yes.
take your doctor hat off, your professional hat off. Put only your mom hat on.
Mhm.
As a mother, what are you loving about parenting your two kiddos right now?
I really learn from them
Mhm.
to enjoy life and be in the moment. I have a tough time with that. So I'm
Mhm.
someone who really struggles with always being in my head. Um, and I think a lot of moms can resonate. I'm not doing enough. Am I doing this right? You know, am I doing this wrong? And they just teach me to enjoy life and not think about it so hard, you know, and I feel that for me, and I'll be honest, you know, I struggle with anxiety myself, right?
Me too.
It's about being in the moment. That's what helps that
Mhm.
anxiety. And it's about like, you know, playing in the snow and enjoying the snow, you know,
Mhm.
and you know, just living life. And I feel like I really get that from my kids and unconditional love too, right? Like
Yeah.
I know I've made plenty of mistakes with my kids, plenty, 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 but they love me
And we'll
anyway
make more, right?
and will make more. And they love me anyway, right? And I'll say,
Mhm.
I'm sorry, you know, when I said this and this that way. And they haven't
Right.
even noticed a lot of the time, you
Right.
know? So just that ability to live in the moment and unconditional love. I wish we all were able to hold on to that as adults.
I know we lose a little bit of that, or it just takes more effort to keep it.
Abs- yeah.
Um, what are you currently finding the most challenging right now?
Being a medical professional and not being able to apply that to my kids, like
Mm.
I'm like my kids are like the shoemaker that has the worn out shoes. And I feel so guilty about that because
So true.
I look at them and I think, oh my, like if anyone saw you and how you're breathing right now,
Right?
they
Or
would
like the
not want to
carpet, home improvement
exactly like,
projects.
yeah, you wouldn't want to hire me if you looked at my kids. Because that's what my kids look like. How can you help mine? But no child,
Right.
for the most part, is overly open, you
Yeah.
know, right. It takes a lot, especially those 13-year-olds. My
Oh
son,
my goodness.
we went to pick out shoes for him. He needs extra stability at his ankle. And I was suggesting which sneakers would be better. And he was Googling in front of me. I have a doctorate. People pay me money for this. And you're Googling which shoe is best to put on, you know?
Right?
But
Oh my goodness. Yes, my son likes to question my sleep standards and advice. And I'm like, you do know what I've done for the last 12 years for a living,
yeah,
right?
sleep is a big one. He'll calculate. I think because our boys are the same age, he'll say, well, mom,
Mhm.
even though I went to bed at 11, I woke up at 9, and that's
Hmm,
enough hours for me.
right?
Like, he'll
Yeah, I mean,
calculate.
he's half right. Sleep, I always say sleep is about quantity. He's on the
Yes,
ball there. Also quality, and sometimes
yes,
when you shift later than what your body wants, the quality is not quite the same. But hey, he's informed, and I think that's awesome.
exactly,
And it seems like
exactly.
we've done a great job teaching them to assert themselves and question everything. And there are benefits to that too. We just didn't know maybe
There,
they
it's
were going
a,
to question
yeah,
us so hard.
exactly. And they question us the hardest, you know?
The hardest.
Um, And I find that with especially, well, even my 7-year-old, to be honest with you, they're, very well behaved in the setting of others,
Yes.
um, but they feel safe to not be so well behaved with
Yes.
me. And I
And
have to
isn't that the
remember,
way we want it?
exactly, I have to remember that that's okay. But
Yeah.
sometimes it's tough, right? Like I know we're child and development experts, but we're human beings too. And
Yes.
sometimes it's tough to just let them be in that space, you know?
Absolutely. And that's why I kind of, I want all the PT information for families. I don't want them to find out down the road, but I'm like really adamant that I want to keep this so real. And like I don't want this to come across as like, hey, we're the experts in all these things. Like
No, my kids are
we're
screwed up.
yeah, we're all figuring it out as we go. We're
Yep,
having very similar challenges and
yep,
joys, and we're all in it together.
absolutely.
It's nothing about it is easy. A lot
Yeah.
about it is joyful.
And
Um,
and and kind of with the wait and see approach and early intervention, it's important. But a mom reached out to me once of kiddos that I worked with, and she said that also puts a lot of stress on you because you feel like if I don't intervene in time,
mhm,
I've hurt my kiddo. So yes,
right.
early intervention is important, but also just like our kids have unconditional love for us and forgiveness, we have to have that for ourselves. We have to
Yes.
be
Give
okay
yourselves
with
grace.
we didn't know at that time, and that's okay. And as much as yes, you want to intervene before the compensation set in, and
Right.
you want to intervene when we can best mold that brain, but if you don't, that's okay too. Like we
Right.
can
Yeah, I
we
mean,
can
we're not like
address
talking about a window that closes or door.
exactly.
It's more of like there's a window of opportunity where this will be
Exactly.
easier and faster to address.
Absolutely.
I say the same
Absolutely.
thing with sleep. Parents say, "What's the perfect age to, come?" I mean, there's pros and cons to addressing sleep challenges at all the ages. We're more
Right.
just choosing like least of all the all the things.
Exactly.
But there's never like it's never like, "Oh, you're screwed. You missed it.
Exactly.
You
Absolutely.
can't do it."
I feel like parents put that pressure on themselves. The reason I brought this up in that manner is because we feel like we should be able to YouTube, TikTok, Instagram, Facebook, everything and get all the answers. And if we
Yeah.
didn't, that's on us. But that's not the case at all. Like how many years of schooling did you go through to
Right.
to do what you do, right? I'm
Right.
horrible at technology, right? So somebody who, has a bachelor's degree in IT,
Right.
I wouldn't expect myself to YouTube everything and be able to do what
Right.
they do. So I think that parents put a lot of blame on themselves because they feel like that information is accessible. But that information is just like, I myself put out information to some degree, but that's just like an example of a very kind of basic,
Yep.
um, and you can't expect yourself to have known everything. And if somebody told you that it's okay, I have parents who have guilt because I knew and yet I didn't do anything about it, right? I want parents to take that pressure off themselves just because it's available to us in some form. It
Yep.
doesn't mean that you're expected to be the expert.
Absolutely. When you know more, do more. It's so true.
Right.
Um, I thought of I we're almost at the last question, but I thought of something I
Mhm.
didn't prep you for.
Mhm.
So in working with babies and children who aren't sleeping particularly well, there is often
Mhm.
another facet of their daily
Yep.
life that is not going well, like
Mhm.
feeding, their mood, their behavior. And a lot of the babies we work with are in some form of therapy, whether it's OT, PT, whatever. Um,
Mhm.
it's a lot for parents, obviously. I really find that we almost have to fix the sleep first or be fixing the sleep along with. Like, I guess my question is, do you see that in order to really make progress, they've got to be getting adequate sleep, or we're at least
Yeah.
working toward adequate
I mean,
sleep?
let's talk about how we feel when we don't get a good night's sleep, right?
Yeah.
You can't function. And that's where the breathing and the postural things come in
Mhm.
too. So if you've tried the strategies for sleep and they're still not working, and if your child has low tone as in PT and OT,
Mhm.
what's happening anatomically that is making sleep more difficult for them?
Right. It can go,
So
it's like a vicious cycle.
it's like a circle, but if we don't address sleep and if I feel like a lot of kids are overdiagnosed with ADHD.
Oh, yeah.
because
And
they're
it's just
not
overtiredness.
sleeping. Exactly,
Mhm.
they're tired. And not to say that no child has ADHD, but
Yeah.
if you're not sleeping, that's going to make it so much worse because you're
Yeah.
exhausted.
And I see this with speech a lot too. They'll be in speech therapy and they're not really making significant progress, and we get the sleep totals up and they're like
Yeah, to pay attention. Like when you're tired, you
yeah.
just want to sleep. You can't pay
Like
attention.
you
You
said, the
can't
body
feel
has to prioritize. It's like a triage
exactly.
thing, right? Like
Absolutely. You
breathing is going to come ahead of this. So it's
exactly.
really interesting. And that's something I would leave parents with is if, if everything feels a struggle, there could be an underlying sleep thing that needs to be
And
addressed, or if their progress is slowed.
I love that you say that you can do it. So sometimes I feel like there's the wait and see approach, and sometimes there's the throw everything. But the throw everything can also be overwhelming. And then you don't know,
Yes.
well, what is actually the cause and what is helping or not helping. So
Yeah.
I think finding that happy medium of kind of what's the priority right now.
Yep. And
And
that eases parents too. Like, okay, we'll focus on one thing. We'll
thing
see
at a
what that
time.
brings, and then we have something else, to move on to if
Yeah.
that's not enough. Um, so it's good to know that that is okay to do.
Yes.
Balance. It sounds like the
Everything is
theme today is balance.
balance, absolutely. And it's funny because I'm a PT and I work on balance, but it's so
Right?
right. I feel like
So true.
in our life in general, we're so polarized in everything that we do in the world that we live in today. We need to get to a happy medium, right? Not every kid needs PT, but the kids who need the PT should be getting it. Not every kid needs an intensive, not, things need to be individualized and things need to work not just for the kid, but for the family as well. I really want to emphasize that because, especially with either babies or kiddos with a more complex diagnosis, we forget the parent. And the parent is the one who's raising the child and who has the ability, to help with these things. But if the parent is overwhelmed and stressed out and feels blame and feels anxiety and is in there, like, I'm not a good mom when I'm in my head and when I'm anxious, and I know it's not my fault. I try to manage it, right? But parents need to be okay too. And when I work with parents that throw everything like into the mix, it becomes extremely overwhelming. You don't know who to listen to if you have different opinions, which opinion, it's
And I
really,
think a lot
really
of us with anxiety have what I call an all or nothing mindset. Like
absolutely
I either did nothing I should have done or I did it all perfectly.
exactly.
And we forget that there's a lot in between those two.
Absolutely. Like I told you before you hit the record button, my house is either perfectly clean or is a mess. I don't have that. Like I'm either exhausted getting everything done, and then I've just had enough, so I can't do any of it.
Right, right. And
Uh,
another thing I often say is like there's people will say like is this amount of sleep bad for my kid? Like is this going to harm them developmentally? And it's very hard for me to answer that question, and I don't want to be fear-mongering too. And there is some research to say that things are affected when we're not getting enough sleep. So the best answer I can give is, and I give it a lot, there's ideal and there's tragic. This is somewhere in between and like way further from the tragic side, right? Like
exactly. Absolutely.
remember the in between. With cleaning my house, I tell myself the same thing, and this took years of therapy and effort. I used to do like hands and knees, and like it would take me hours and just kill myself with it. And now I'm like, you know what, I'm gonna leave it better than it was when I started.
Yep.
That's the in between, right? I'm not doing
Exactly.
nothing. I'm not killing myself. I'm just going to perk it up a little bit and be happy that, it got done.
I
And that's way easier said than done. But if you can get
Absolutely. I
there,
tell parents on evaluation, I give a lot of information and I know that that could be overwhelming. And sometimes I feel like I have to scale back, but I also want to give them the information. So, let's say I give, this morning I saw a kiddo, I gave 4 positions that the mom can utilize to help. I said, today, work on one. Tomorrow, work on the same one if you still don't feel comfortable with it and work yourself because that one position that you're utilizing, you didn't utilize it yesterday, right?
right.
So if you take away 5% of what I teach you today, that's
Mhm.
5% more
Right.
than you already are doing. And
That's
I'm very good at giving that advice
yeah.
and not incorporating it in my own
And that
life.
must just put parents, like, all the overwhelm
Yeah.
just probably melts away.
Yeah, because it's
Yeah.
tough when I say I want to educate and I want to empower parents, and then they feel like, oh wow, now it's on me, you know. But I say I'm there to guide you and I'm there to support you. And
Yeah.
every new thing that we do is a new thing that you did not do, right? So there's going to be that degree of improvement, right? With my own kids, I joke and I say, there are things that are wrong that I didn't address, with each new thing that I'm able to add and explain, it's still better than it would have been, and
Absolutely.
parents need to know that our kids have issues too. Like,
Yes.
it's not
Oh, do they?
very much so. Um, so it's okay. Like, we don't have to have it. And we can talk about this for hours, right? But
Yes.
social media makes it seem like things are
Oh, yeah.
perfect.
Yeah.
But, as much as I put up videos of certain exercises, right? How many videos, how many trials of that exercise did we do? And I
That you
need to
didn't get
get
to see.
better at putting those up as well, but I don't
Yeah.
videotape my sessions. So usually the videos that you see, it's the parent took the
Right.
video and sent it to me. Um, but there's trial and error and there's
Mhm.
failure before success, right? So
Yeah.
it's important to lose sometimes, and
Yeah.
that doesn't mean that you've hurt your child. You've learned something from that and you're going to do better.
Awesome. All right. I'm going to be mindful of your time. I have one last question for you,
Yes.
still with your mom hat on. What
Yes.
is one thing that you've learned on your own parenting journey that maybe we haven't touched on yet that you wish you knew sooner and you want to tell other parents now?
Honestly, to have space for yourself for forgiveness.
Mm,
I'm still learning it. I'm very tough on myself as a mom. Um, our kids are very forgiving.
thank
And
goodness.
and if we allow ourselves to take that stress off of ourselves, it's going to make parenting a whole lot easier, functional. I'm still learning it. I wouldn't say I've learned it.
I
I'm
think the
still
best tips are the ones that we're still actively working on ourselves.
absolutely. And then the other thing too is when you feel like you've had it under control, you're going to lose it. And that's
Nothing
okay.
lasts forever, right? The good, the bad,
Nothing
the
and
ugly.
it's okay. My mom, when I was pregnant with my mom's cousin said to me, like, when you become a parent, you start to worry, and that never really leaves, right? And you feel like you've had this, like you've had sleep is great. They're sleeping now, right? And then they start teething, and then they're
Yeah.
not sleeping anymore, and then
Yeah.
something else happens. So you're gonna have these constant challenges as a
Mhm.
parent. Have patience for yourself and for your kiddos. It's okay to make mistakes. It's okay to not be perfect. Sometimes we might yell, and that's okay. And as long as, at the end of, like, I'm sorry, that's not how I wanted to come across. Like, we need to demonstrate to our kids not how to
Modern.
be perfect, but how to make mistakes, recognize them, and then move on.
Yeah. Oh, I love that so much. Excellent advice. Dr. Anna, thank you for joining us.
Thank you.
Listeners, I'm sure I'll have you back again. Listeners, I'll be back soon with more stuff that I and other parents wish we knew sooner. In the meantime, I'll leave you with my personal list of stuff that I had to learn the hardest way. It actually applies a lot to what we were talking about today. Accept help when it's offered, ask for it if you need it, and it isn't. You are the expert on your child, so trust your gut. And if you
I
need
love
to
that.
be, right? If you need to be the squeaky wheel. Do not wait
Yes,
and
I
see.
say that too. I'll be very quick because I'll say this. I moved to Pennsylvania from New York, where parents are a little bit squeakier. I think everyone is so nice here. It's okay to not come across as nice. It really is okay. So I love
Yeah.
that you give that advice. Be
Oh
the
yeah.
squeaky wheel.
I talk about the mom guilt, the regret, the beating yourself up. I have so many regrets over not being a squeaky wheel sooner and louder, and I am still working on that now, but that experience was actually helpful. When I feel like I need to be, I now can pull on that and say, remember what happened those times when you didn't, and you're the one that
Exactly.
needs to advocate for him. It might be uncomfortable for me,
in
but
the moment.
his needs take priority. Exactly. Excellent. This is wonderful. Thank you
Thank
so
you so
much.
much for having me. I love what you're doing. It's
Yes.
awesome.
Thank you. We love having you here. And I will be back soon. Thanks everyone for listening and watching. Bye.
Bye.